For the drugs that we have approved, for example, Ibrutinib, Idelalisib, there are patients who go on those drugs. They're extremely effective drugs at controlling the disease, but patients do have to come off treatment occasionally for side effects, and they're generally drug specific, so the side effects that you'll see with Imbruvica are different than those that one would see potentially with Idelalisib. There are newer drugs that are in development and that clinical trials are ongoing that are in the same category with respect to the mechanism of action, but may not have the same profile, toxicity profile. So right now we have Imbruvica, which has its specific associated side effects, and if patients have to come off for those, they're not overlapping necessarily with the toxicities that you see with Idelalisib. So Idelalisib is the next reasonable, rational choice today. Tomorrow, or in the future, that may change because we may have Imbruvica and you have a patient who's doing very well on Imbruvica. They have an Imbruvica-related side effect. There may be another BTK inhibitor available for those patients that would not potentially have the same side effect profile as Imbruvica. That would be an option. That's probably in a few years, a couple years, because obviously all of the clinical trials need to be conducted in order to get these newer agents that are effective approved by the FDA. And we have other new agents, for example, venetoclax, that are in a whole different category with regard to mechanism of action. Also different side effect profile, but different mechanism of action, which is hopefully going to become an alternative, a next alternative therapy.